I am Gina Aditya. I nurse in this hospital. Okay, tell me about yourself, please.
Good morning. My name is Wiwi, a graduate of the Tasikmalaya Health Polytechnic. I am an enthusiastic and responsible person from the achievement gives to me, and I will like the knowledge in this field. From me, nothing is more satisfying than help others when they need I most, and their smile is my happiness.
Do you know about our institution?
One, the hospital that has national standards and is accredited. The vision of the hospital of choice for high quality community. Its mission is to provide quality service, personalize patient safety, and provide appropriate medical equipment involved in public health service.
Did you decided on a career as a nurse?
My family has no background or whatsoever in medical field, but I have been very interested in the world of health science. I was a child. When I was little, I dreamed of becoming a health worker, so I was help people who were in need of help best I could. I was happy to see medical staff, especially nurse, help my mother in giving birth my sister. Since then, I was motivated to become a nurse. For me, a nurse is noble job because they help others sincerely without thinking about their background, ethnicity, religions, and to the nation. The most important thing right now is that I'm proud to be a nurse who can benefit others and be able to make sense of life and always grateful.
Tell me what you felt your great skill as a nurse.
I am very proud of my ability to communicate, listening to what patients tell me and their response with attention and explanation that are easy to understand. So they feel calm and help in care they undergo. I have dealt with patients who have anxiety about an action, but after a communication with this patient, the anxiety they feel in decreasing.
How do you handle the stress of the job?
I think the best way to deal with stress at work is through organizing the meet, relaxing for a moment, and sharing express with colleagues. By making groups and prioritizing what has to be done and what is set aside, I do the more important text first and then the other text so that it can help me anticipate things that didn't want to happen from the start.
What do you find is the hardest part about being a nurse?
I think the most difficult thing that I had to deal with was my education as a nurse as during my practical work. Because I have to be apart from my family and settle in a place close to where I carry out education, and also the problem that I have to face during my fieldwork practice. I see someone who is in pain and some are feeling sad over the loss of their loved ones. Often thought I'm very care about wanting to help them, but I can do it.
Why do you want to work here?
I would like to contribution to the knowledge I learned during nurse education that I have lived through the last technology used in patient care. This hospital is included in the national standard because it is supported by the last innovation, and I'm very excited about the opportunity to be a part of this hospital and learn a lot from the expert here.
Are you comfortable working with other doctor and nurse?
I can do teamwork, but with doctor and other team healthy works. Because of the work of the team, I can see the condition from virus perspective and how to handle it to help patient undergo treatment faster and be able to recover. But here are times when I do dependent work and still feel comfortable with the work done.
Describe a time you had to deal with a difficult patient and how you handled that.
I once provided nurse service to boy patient had fear of treatment, namely medication injection. The child is angry, crying, and often offends the nurse because then they don't want to take nurse action. When I can that I will be saving the child, so to handle it I swear that the child like I discovered that her mother had a habit of during her attention to watching movies. I invite the patient to give half the film that the child likes and let him some medication defense. Also explain the purpose of the action taken. This can reduce the fear of the child so that when the injection is taken, there is no element to reaction anymore.
Why should we hear you?
Although I'm a fresh graduation from the nursing campus, I know that as nurse is a noble work. This is humanitarian profession to help follow human beings without destroying their background. I have to update about progress in the health sector and its supporting technology. I love the passion in this job. So many things can teach me to use the opportunity and the best time possible.
Do you have any question for us?
I have question. What can I get if I am accepted in this institution?
Getting college, studying various cases in patients, making dynamic change to the let's health church and learning teamwork.
How many nurses are there at this institution and how is the division?
There are about 274 nurses and the division of nursing is done according to the theory of Gallis and the Ministry of Health.
Is there a change of employees every year?
There is a chance of employee in the room or can be called a rotation more privilege.
What is a gradement of office for when in hospital?
Still generate 3 shift and every 2 night shift get a restoration.